Hello, everyone. A very warm welcome to another exciting episode of Psychology Talks. And today's episode is something that I was quite looking forward to it because a lot of people have been asking a lot of questions about that. What difference do child feel when they are either diagnosed as or having some neurological disorders like ADHD, dyslexia, or autism? And the thing is that the numbers of having this kind of disorder is staggering, like quite rapidly. And we see that almost 1 in 10, especially in 1 in 10, like a boy is having kind of ADHD or autism. So the prevalence rate is much high, and the problem is that there is not much information about it, and people don't know that what is going on, whether there's something wrong with the kid or there is something wrong with the system. And and most uh, and the problem is that the child suffers, and because they think that there is something wrong with them, and they feel that I think they are broken, and they develop some other mental disorders where they develop some other mental issues. So that's why today I have invited one of the leading world-renowned expert in brain health. He's specializing in childhood and adult neurological disorder. He's a clinician, professor, brain researcher, best-selling author of the book Disconnected Kids, and he focuses mainly on ADHD, autism, OCD, tics, anxiety, and other development issues. Dr. Melillo is dedicated to bridging brain function, behavior, and physical health. His innovative multimodal approach, the Melillo method, has transformed thousands of lives. And today we'll discuss about this revolutionizing method. So welcome, Dr. Robert Melillo. Thank you so much for joining. It's really an honor to have you with us today.
Oh, thank you for having me. It's an honor for me to be here.
Yeah, I mean, I actually got this book recently, and I've been reading this. It's a wealth of knowledge. The thing is that when I order it, it takes almost 3 weeks to come to Saudi Arabia. So I'm just halfway through. As soon as I finish, I'll just also give a write a review on this. But it's an amazing book. I think everyone who is looking for some information about this, that what is ADHD and how we can help kids, I think I highly recommend this book, Disconnected Kids. So anyways, I gave a very brief introduction about you, but tell us more about it. Like tell our audience that why particularly you're interested in ADHD, autism, and specifically for kids.
Yeah, I was always, as a clinician, my focus has been really neurology and rehab, and I received a subspecialty in neurology and rehabilitation early on in my career, and I got into teaching and, really trying to figure the combination of rehabilitation in nervous system and brain. But really what got me into a lot of the ADHD and childhood issues was really my own son being labeled with being told that he may have ADHD. And at the time, I knew a fair amount about the brain, about neuroscience. I was teaching on a postgraduate level, clinical neurology, but I wasn't quite sure at the time what ADHD was or what autism was. And so, I wanted to go and ask some colleagues to see if they could answer. And they all told me the same thing, that they really didn't know what it was. And so at that point, for me, the number one question in my mind is what is happening in my son's brain, and how do I help him? And people were telling me, well, you can't help him anyway. There's not anything you can do about it. But, it didn't make sense to me because the people that were telling me that also couldn't tell me what the problem was. So that's really where it started with me. And, as a parent and really having my children be very important, it really was something that I really gravitated to, and it really got me focused. And I really found it being very fascinating, but also In my career, I didn't think there was much more of an impact I could do than to help children and their families that were struggling, especially those who really weren't speaking. That really became a lot of the focus of my research.
Yeah, that's quite inspiring because you actually gone through all the experience, but because a lot of people, like being a psychologist, they come to me, they ask me that their kids have been suffering from these kind of disorders or something, and they don't know. I mean, seriously, they don't know where to go. There is a lot of labels attached to it, like because if something is wrong with them, people usually judge them, right? That okay, I think their kids is something wrong. They also point out that their parenting is done wrong. So there's something, a lot of shame, a lot of stigma attached to it. And as you mentioned, that your own son has been like going through it, so I think you know it better, that what kind of anxiety people, especially parents, go through it, or frustration they go through it when their own kids actually going through it. So tell us a bit more about that. What early signs parents can detect or identify when their kids are having any neurological disorder?
Yeah, just to play off what you just said, about what parents feel. I felt all of that as a professional. I felt, how did I not know this? So I felt bad. I felt shameful that I should have known. I should have seen it in my own son. And then, of course, immediately, like most parents, I felt like I was to blame in some reason because I was working too much or I wasn't there or whatever. But at the same time, feeling that really motivated me to do something. So when we look at early signs, to me, one of the things I have a PhD in developmental cognitive neuroscience, and I've spent a lot of my time really looking at the development of the brain and how the brain is normally supposed to develop. And the good news is in that almost all of these disorders or issues, there is no damage to the brain. There is no clear-cut single genetic mutation or maybe no mutations at all. There is nothing per se wrong with the brain. If anything, many of these kids come from families where they are passed on certain traits where they're gifted. So it really comes down to looking at their early development. And for me, really looking at the steps and more people are being told, well, that doesn't matter. There's a wide range of how kids develop. That's wrong. That's not true. There's a very narrow way. To me, there's what I call a brain developmental blueprint. Building something as complex as the human brain, which may be one of the most complex things in the universe. It's not just like, okay, well, follow whatever directions you want. If you hired an architect to do a really good detailed blueprint of a house that you were going to build, you wouldn't just give it to a contractor and say, well, do whatever you want, use a wide range of, no, you'd want it done exactly that way. So for me, one of the first things is even in the womb, if the baby isn't getting into the right position, if they're in a breech position, if they're not, far enough down in the birth canal, if the cord gets wrapped around their neck, there are these pre-birth movements called primitive reflexes or neonatal reflexes. That is, one of my main areas of research. And to me, that starts again in the womb before birth. When they come through the womb, they're supposed to use those reflexes. If they get stuck on the way out, they need forceps, if they need any assistance, vacuum extraction, if there's a real problem, then to me, that means that the baby is not using their reflexes to help themselves get out. And then right from the beginning, the first thing, if a mom chooses to breastfeed, should be the rooting and sucking reflex. They should be able to latch on really securely and cause proper letdown of milk. And if they're not, then that may, again, signify that there's a delay. And then if there's a delay in any of these reflexes coming on, there may be a delay in when they roll over. They should roll over at 3 to 5 months. Then they should be able to do the commando crawl on their belly. Many kids skip that completely, and parents don't even know that that's really a thing. And then crawling on all fours, and then children should be able to sit up on their own and then pull up and then stand up. And then right around 12 months, like right around that, between 11 to 13 months, all children should walk a few steps, should say a few words, and should be able to point and wave. If they're not doing any of those things, To me, that is a red flag right from the very beginning. And it's something, that we need to pay attention to. And people aren't being told that enough.
Yeah, yeah. And but the thing is, like, there's a lot of things, like, especially with a lot of shame and judgment attached to it. So maybe that could be one reason that people, keep it like to themselves, that people don't tell that, okay, their kids are not walking or their kids are not pointing or something, because usually people actually point out to or judge them. They say, okay, you are not giving them enough time or something. So that could be one reason that is a stigma attached to it. And there people are more, quick to judge others. So
Yeah, I think it's that. And I also think that, I find that parents are usually on top of it, meaning they are paying attention. And if they're told, listen, look for these milestones, they're looking for them. And more often than not, if the child doesn't meet it, they go to the pediatrician. They go and they say, hey, they're not meeting these milestones. And usually the pediatrician is the one who at this point says, it's not really that important, or don't worry about it, or all kids develop at a different time, or just sit back and wait, they'll catch up. And I think it's mainly because they don't know what to do about it. If the child is behind, they don't really have any strategies that says, okay, can we intervene? I mean, we hear over and over that early intervention is the key, but what does early intervention mean? And maybe they might recommend that they have some early intervention treatment where they may get OT or PT, but nobody is really looking at these reflexes the way they're supposed to, or really working with, I think, the primary root cause. So I think that it's maybe partly that the parents might feel shameful. Maybe they're not doing it, but I think more often than not, they're not getting the information they need, and they're being told, don't worry. And it's actually pretty frustrating for them, because down the road, if their child is diagnosed with something, they say to themselves, I said something early, but nobody gave me any answers.
Yeah. That's you pointed out very correctly that, that the other pediatrician or the people around them are actually don't know what to do. So awareness is the first key. I think it's very important to get to know that, okay, even if someone is worried about that, why their kids are not developing their milestones correctly, they need to have this awareness. And I was reading your book, and you just mentioned that it is mainly because the two hemispheres of the brains are not developed, or are not in sync, or are not balanced. And that's the reason. If you would like to maybe tell a bit more about it, that what happens in the brain and why it gets imbalanced, or how it can be connected. In fact, one more question that I want to ask in this, because it is linked with this, because most of the time people actually say that ADHD, all these neurological disorders, do not have any cure, because they have to take either long-term, lifelong medication. But I was like reading your book, and you mentioned that it's just the imbalance of the brain, and when you just did that, it can be cured. So just tell us a bit more about it.
Yeah, I think that, the idea of curing or not kind of speaks that there's some sort of disorder or disease, and that's not really how I choose to look at it. I think the neurodivergent model is really a better model to look at it. But the idea, though, that, we all have our brains are different, and we have different personalities is good. We have different strengths and weaknesses. But we also know that if we have too much difference between our strengths and weaknesses, these present with issues. And I think when we break down any really mental health, neurological disorder in children and in kids, we're looking at certain areas and certain networks in the brain that might be overactive or overfiring, and others that are under firing or more immature than they should be. Overall, what we've been able to show is that in almost all of these issues, we know, I'm sure you know as a psychologist, that we're kind of recognizing now that almost all, even adult mental health issues, really start in childhood. And they're really kind of the end result of the way our brain was built in the first 6 years or so. So the way the brain is supposed to be built is, as we said, we're supposed to go through these different movement milestones, and that activates genes that helps to build our brain. The human brain is unique in that we basically have the most immature brain at birth, and that, we only have about 20% of our brain at birth, where most animals have a lot more. Other animals can stand up and walk and run. We won't be able to do that for a year. The part of our brain that helps us to really move in in a purposeful way isn't really there. So we're born with these primitive reflexes in our brainstem, and our brainstem starts first and it comes online first. And so the brain literally builds from the bottom up. And like building a house in different floors and a roof, we need to make sure the foundation is solid. And the foundation is the lower part of the brainstem. And that's also where we have a lot of regulation of our digestive system and our immune system and inflammation and anti-inflammation. And all of that, for all of that to come the way it's supposed to, we need to get rid of these reflexes. We need to move, and we need to see that the bottom of the brainstem is mature and solid. At the same time, so the brain comes up and then it comes down, and the brain comes down and regulates everything in our body. At the same time, the right brain takes the lead in development in the womb and for the first 3 years or so. Then the left brain comes online. And that's very important because that is what establishes the differences between the right and left brain function. Again, that is another very important thing. Humans have the most differences between our right and left brain, and it's obviously an advantage. It essentially gives us two brains in one, and it allows us to kind of do two things at the same time. Like an example that's given is, let's say you have an animal, and all animals have asymmetric brains. We wrote a paper about 1.5 years ago in a major journal, showing that brains we know were asymmetric going back 500 million years ago. So from the very beginning of brains, there was a right and left side of them. And we have the most evolved. And so that those stages of going through that, again, anything that alters the way we're moving, anything that alters the way we're interacting with the world, if we're starting out behind, if these reflexes aren't coming on, they don't go away when they're supposed to, and now they hold back the brain. So at 1 year old, all these reflexes should go away. We should go to the next stage of development, more complex movement, build a more complex brain, and then eventually cognitive skills and language and all of that grows out of that. And then again, the brain should regulate it. So what we see is that if there's no what we call vertical integration, it interferes with this right and left, and where there's a difference where the left brain may come online too early and stop right brain development, or the right brain stays online too long and stops left brain. And then there's too much of a gap. And that is where all the symptoms lie. And that's where basically every disorder lives.
All right. I mean, that's very interesting that it's just that all the mental disorders are just the imbalance. So you said that all the mental disorder, or it's just like these ADHD or these neurological disorders are there?
No, virtually most mental health disorders. I mean, even things like depression, anxiety, depersonalization, derealization, dissociation. I mean, more and more it's being recognized that when you look at these terms in neuroanatomy standpoint, which is the way I choose to look at it, I choose to look at it like, I look at what we call applied neuroscience, meaning what is actually happening in the brain? Where do these symptoms come from? The right brain generates emotions like sadness or fear or embarrassment or shame. The left brain generates joy and pride and anger. If we have too little joy, too little pride, and we have too much sadness and shame and guilt, that to me is major depressive disorder. That's where it comes from, right? And we can look at it the opposite, where manic behavior may come from too much joy, narcissistic behavior, too much pride, too little, shame or guilt. So, we can look at these things in the way that the emotional balance or regulation or motivational differences, how we think, or whether we're again, the right brain does something called reality testing in an area called the dorsolateral prefrontal cortex. The left dorsolateral likes to live in a virtual world, in an abstract world of abstract symbols and non-reality. If we have too much non-reality and not enough reality, we lose touch with reality. That's psychosis, right? So I tend to look at these things like that.
Wow. I mean, that's really amazing, because we, as a psychologist, we just try to see things like how we can maintain our mental health, like through changing our mindset and through this. But of course, you're saying that there are some physiological imbalances that creates this kind of disorders. So what do you think, what is the role of therapy, like as a psychologist, as we give them to treat their mindsets and treat their traumas through just therapy? Do you think that it can be like a balance can be achieved through these therapies, or how do you think, I would say, that the best way to achieve the balance between these two hemispheres?
Yeah, I don't know if you're aware, there's kind of a movement in the psychology and psychiatry world by a group, and they're headed up by people like Alan Shore, if you've ever heard of him. He's the head of the Geffen Institute. And then you have like Lou Cozolino, who's another psychologist in California. And then you have Dan Siegel, who's a psychiatrist. And you have Ian McGilchrist, who's a psychiatrist from the UK that writes a lot about brain asymmetry. And there's a movement in some groups about doing therapy directed towards the right brain more, or therapy more directed towards the left brain. So there are ways of, especially right brain therapy, because a lot of talk therapy seems to me more directed towards the left brain, but the right brain is where a lot of trauma lives. It's a lot of, emotional regulation issues or attachment. Attachment is primarily associated with right brain development. So anything that alters, again, normal development of the right or left has an effect. Now, I think if you look at an example like adverse childhood experiences, what's called ACEs, we see that, these are individuals or children that may have been subject to something that like abuse or neglect or some sort of traumatic experience. And we know that it has an impact on their lifelong health and mental health, physical health. They tend, if there's 4 or more of the 10 that have been identified, there's anywhere from a 4 to 1,200% increase of things like cancer, diabetes, suicidality, or, all of that. And so when we look at what is the core problem in that, the trauma and early trauma has an effect on neurodevelopment. It alters neurodevelopment. But yet, if a child is traumatized by their parent, or they're in an abusive relationship, or they've been neglected, there are going to be emotional and psychological scars. But again, if there are imbalances, to try to get these networks to reintegrate, because ultimately I think in psychology, that's what really psychologists are doing, whether they're conscious of it or not. They're trying to reintegrate networks, and they're trying to get parts of the brain to work together. Lou Cozolino wrote a great book called The Psychotherapy, or The Neuroscience of Psychotherapy, where he talks about, why do people come in for therapy, and what are you trying to do? And he said, basically, if people have networks in the brain that are not integrated or not synchronized and not communicating or out of balance, that is usually what produces symptoms that people come to a psychologist for. So ultimately, trying to reintegrate those networks is what we're trying to do. So I think if work together with someone like a functional neurologist like me, I also have a degree in neuropsychology and, like I said, a PhD. But the idea is that working together with a therapist to heal both sides, I think, is really the ideal situation.
Yeah, I think that's what, like, I was reading in your book also, that how these movements can help us to actually create the balance. So tell us a bit about your Melilo method. I think that is quite revolutionizing, and that is you've treated a lot of kids with autism, ADHD with this method. So tell us a bit more about it, that what exactly it is and how it helps kids to overcome these kind of neurological disorders.
Yeah, well, when we look at reintegrating the brain or reintegrating networks or integrating them for the first time, how do we do that? Most people don't know. We hear about, brain stimulation or whatever, and we tend to think in chemical terms like medications, which really doesn't do that. It manages symptoms, but it doesn't reintegrate or cause integration of areas of the brain that are not integrated. We think of thinking skills but we need to look at the brain as like a muscle that essentially it grows, and everything that we do, the brain regulates everything, every emotion you have, every feeling you have, everything that's going in your body, whether you're consciously aware of it or not, is being controlled by your brain at all times. And any thoughts that you have, negative thoughts, if you can't regulate your emotions, if you're depressed, if you're anxious, if you're in a fear state, it's really because certain networks in your brain are firing off. Now, especially if there isn't some of that, if you're not in danger at the time, but you feel like you're constantly in danger, or, you don't have anything greatly to be sad over, but you're sad all the time, then you know that it's really your brain generating these things and creating that reality in your brain. And these are emergent properties, which means they come as the brain grows. Different skills in our brain, different areas of our brain control different functions: sensory, processing, vision, sound, hearing, smell, taste, touch, gravity, cognitive abilities, speech, executive function, planning, setting goals, inhibiting things that we don't want to have happen, being able to have a balance between our emotions and being able to have mental flexibility, doing math, reading, comprehending what we read. All of these are skills that grow into the brain as we're doing it. And first, before we can have that ability, before we can get taught that ability, that part of the brain has to grow. And so what we're seeing is, this is the problem. These areas of the brain aren't growing the way they're supposed to. They're delayed, or because one side has come online, it's holding back growth and development in the other side. And so we want to use a variety of different brain stimulation tools, but it starts from the bottom up. So we need to get rid of the reflexes, which may be holding the brain back. We do that through a series of stimulations and exercises that we mostly teach people to do at home, and we also do in our offices. We then need to promote balance. So we activate one side of the brain using things like light or sound or different frequencies of colors or smells or vibration or inner ear stimulation or different frequencies of music or different frequencies of flashing light that literally create different changes in the patterns of brain waves in the brain. And we can create them to try to create a balance so that they can become synchronized. We do cognitive things like academic skills, or we'll have them do certain cognitive exercises with their brain, or we have them do something called neurofeedback, where they try to get their own brain waves into a specific brainwave pattern. We have different video games and virtual reality where they play these games and they work on specific cognitive skills in their brain while they're doing things. We also do direct stimulation to the brain with different types of electrical devices like transcranial direct stimulation or alternating stimulation. Or we use, again, TENS stimulation. And then because the brain regulates everything, we often see that they have digestive issues, they may have food sensitivities, they have imbalances in their immune system, and we need to address those things as well. So it's a very comprehensive program that looks at everything, but it's also individualized to each individual patient.
Yeah, amazing. Actually, this is such a wealth of information. Like, you concisely said everything in this, like whatever I was reading in the book, that basically you just pointed out also that these kids generally develop a lot of health issues like the allergies and digestive issues and everything. And like, as parents, they don't know what's happening to their kids. Like, when they go to the different doctors, they give them different kind of medication, yet they are so confused and kind of frustrated because they're seeing that their kids is actually suffering, but they don't know how to actually help them. So I think this is very important. Like, people should know that there is a way they can actually treat them. And especially with the autistic kids, like, I've seen autistic kids that they are, first of all, they are not socially, they don't have that skill to mingle up with others. That creates problem. And then, of course, these kind of medical issues that also creates a gap between them. So I know this is actually a very wide topic and we can go on and on. But before actually I close this show, I want to talk about, because you mentioned that you're very much interested in helping people who cannot, kids who cannot speak. So how we can help them? What problem are they facing? Why they are unable to speak? I mean, is it because of there's some problem in the brain, or is it just a psychological problem?
Yeah, it's a great question, and it's a question that's kind of haunted me for 25 years at least. When I wrote my first textbook, I remember, that came out in 2004. We're gonna be doing a second edition of it now. Um, One of the questions right from the beginning was, why don't these children speak? Nobody really explained that. Nobody since has ever really explained that. Some people have come out with different theories, but most people assume that there must be some sort of left brain problem with the language center, especially an area called Broca's area, which is in the left frontal lobe. And the answer is that's not it at all, actually.
Oh.
I've been looking at this, and I think that, especially in the last few years, because I think it's one of the most fascinating things, because we work with kids, and there's obviously a wide range of kids, but especially my focus has been on non-speaking kids and trying to understand why they can't speak and get them to speak and communicate. And we're very successful at doing that, more successful, I think, than anybody, because we understand and we're looking for the root cause. And real quickly, I think basically, as these are problems that start again with development of the right brain. The right brain is altered, where these kids are gifted. First of all, every kid that's on the autism spectrum, whether they're speaking or not, is essentially a genius with their left brain. Now, again, we're not talking about kids that have true genetic mutations that might also be labeled with autism, or people with brain injury. We're talking about people that have, normal, healthy brains, but they haven't grown properly, and they have these advanced left brain skills that tend to run in their families. Simon Baron-Cohen out of Cambridge has shown that in the families of kids with autism, there's a much higher percentage of people that are physicists, mathematicians, engineers, scientists, or people in finance, or doctors or lawyers, so that the left brain skills are usually gifted. And if they have both parents, their left brain is very strong. But what happens is that, again, that right brain is supposed to be taking the lead in development. And if these reflexes don't go away, the right brain now is held back, and their left brain, because it's so powerful, it comes online too early. Some of them, almost from the very beginning, their left brain is coming online too early. You see these kids. I mean, I had one kid from the UK that the parents swore he could read when he was 8. And kids that can read at 1 or 1.5, or memorize books at 1, where they're fascinated with numbers or letters, or where they believe they can remember when they were born, or they get eczema, or they have immune dysregulation right from the beginning. So I believe what's happening is that as that right brain should develop, we should have what's called interoception. We should connect to our body. There's an area called the right insular cortex. We know that that's severely deficient in kids on the non-speaking end of it. They don't really feel pain or temperature at the same level of other kids. They may not know when they have to go to the bathroom. They may not feel tired. They may have very picky eaters. They're not eating properly. And then from there, we literally create these maps in our brain, in our parietal lobe, where we develop a sensory map, which is literally this 3D map of our body in our brain. And then in front of that, in the frontal lobe, we have a map of our motor system. So we have where we see our body in our brain. And once we see it and we know where our body is, we then develop the ability to move that part of our body. And that is the root cause, I believe, of why these kids aren't speaking. It's not, most of them have all the words are there in the left brain. And it's not that they have a problem in the left frontal area. It's a problem with the right, and not feeling their body, and not being able to move their body. And that's very important, because some people may go and try to stimulate the left brain. And that's also where OCD and tics and stimming and anger and inflammation come from. And when they do that, they tend to make those things worse, not better.
Oh, yeah. I mean, that's like amazing insights, that it's basically they have this, but it's just that they need some, maybe a right stimulation to get into this, to get through, basically through their mind, so they can actually, they're aware of it and they can use it much more effectively. One thing that I know that I have actually lots of questions, but the thing is, like you mentioned also here, that they are kind of like autism, the people who are on autistic spectrum, they are kind of genius, or they have like maybe from this, or maybe I would say that all these like ADHD or any other, like I would say any issues, they might be having maybe some sensory stimulation or some mental stimulation is, I think, more sensitive to something. So like when we're treating, so do you think that are we treating them, are we trying to get them again into the box and trying to maybe reduce their geniusness or something like this? I mean, since like everybody is different, and maybe if we actually maybe I don't know how to actually frame this question, but maybe I'll just try to explain that, the bell curve. So like we try to put everyone in kind of those in the middle section, or in the middle section of the bell curve, where majority of the population is. Those people who are on the spectrum are kind of like on the other sides of it, either on the left or the right, wherever it is. But when we try to treat them, we're trying to put them into the middle section. So, we can either remove the label, we can just say that, okay, you are normal. What do you think? Is there a risk that we are actually reducing their geniusness by giving them this kind of medication, or trying to put them again into the box, or into the where normal or average population is?
That's a great question. I don't know if anybody's actually asked me that question like that. That's a really good question.
Thank
And
you.
it's a very important point. And so, like you said, there's a bell curve, and
Yeah.
there's what we call standard deviations, right?
Yeah,
And
absolutely.
we know that, like, if you're looking at IQ, for instance, 100 is the middle. Between 100 and 115 is what's considered one standard deviation. Between 115 and 130, or between 85 and 70 is considered that's all considered
Yeah.
in normal, high normal, low
Yeah.
normal. If you go to 130 or above, that is genius.
Yeah.
So that is what we consider genius level. If we go below 70, we consider that disability. What we see with these kids is they have both their right brain or their left brain. In autism, their left brain is in the genius realm, but their right brain is in the disabled realm. And the gap is so wide, and that is the problem. So you're right. I always tell parents that this all starts with a gift. I tell them that you gave your kid a gift, or even an individual. We see these people that in the ADHD or in dyslexia or in OCD, that they're very bright, they're very talented, unusually so in other areas. And that's not a coincidence. It's actually why they're vulnerable to the imbalance to begin with, because areas of their brain are naturally stronger. That was a trait that they got.
Yeah.
But because of that, they have a vulnerability. So what we don't want to do is we don't want to take away their gift. We want to just take away or build up their weakness to match it more, right? We all have strengths and weaknesses, but when they're too much, the weakness outweighs the strength. And so we know that we do that. And how do we know? Because one of the tests we do is a neuropsychological test, an academic test. And I have a degree in neuropsychology as well. And so we'll do, let's say, a Wyatt or a Wechsler test. And we see that many of these kids might be 5, 6, 7, 8 years above in certain grades, in certain subjects like word reading or basic math. And then they may be 5, 6, 7 grades below. We have some kids that are 10 or 11 years old and have, a 6, 7, 8 year gap between their skills, and they're maybe way ahead. Now, when we work with them, we're working on their weakness, and we may actually want to calm down their overactive brain. But what we see is that they don't lose that upper skill. They just get the bottom skill to come up to match it. And so what we believe is that we can make them just gifted the way they're supposed to be. They're supposed to have a balance of gifts in both areas of the brain, and it allows them to tap into that gift so they're not so obsessive. I'll give you an example. I have a kid. We had one kid, his name was Bobby, and when he walked in, he was very nice kid on the autism spectrum, was verbal, but as soon as you met him, he would ask you what your date of birth was. And it was, he couldn't help it, and he didn't read the social cues, and And people would tell them, okay, I was born on this day this year. And immediately he would tell you exactly what day of the week it was and who was president of the United States. And he did it to everybody. And it was very awkward the way that he did it, but clearly a genius level skill. I mean, this kid, we asked him one time how he did it, and he said he basically would go back like 700 years and come forward, right? In instantly. Yeah. So brilliant. But as we were working with him, Bobby started doing great. He started being much more natural in his socialization and his speech, and he won Student of the Month a few times, and everybody was happy. He was developing friendships, and he was really doing great. And his natural intelligence was showing. And so now when Bobby, if you met him, you know, he wouldn't ask you, you know, when your birthday is. But if somebody said to him, you know, if you went up to him and said, Bobby, you know, do that thing, right? So he would say, okay, what's your birthday? They would tell him. And then, you know, a little bit more slowly, but he would say, this is when you were born. This is, the gift was still there. But it wasn't so obsessively present, and he was more aware, and he was more aware of what was socially appropriate. So, yeah, that's a great question, but we just want to create more balance. We don't want to change it. I always say we're not looking to change the person. We're looking for them to become the best version. And if there's a really big gap or imbalance, they're not the best version of themselves.
Yeah, I think you gave a very amazing answer to this, that how they can actually survive in this world, because of course there are expectations from the others, there are expectations from society, and they have to live in this world, and we have to help them use their gifts. So I know, as I told you, that I can go on and on. I have lots of questions like this, and I'm really enjoying this book. So I think everyone who actually needs some answer about ADHD, autism, please get this book. It's available on Amazon. And please tell us that what is the best way to actually find you, how our audience can connect with you.
Yeah. So by the way, with the book Disconnected Kids, we just came out with the 3rd edition, you know, this past summer in August. So it's really updated on a lot of our research. And I've written over 100 research papers. And the most productive period of research has been really within the last 3 or 4 years. We've published a lot of papers, and a lot of that new information and research made its way into that book. And it's translated into 18 languages at this point. So it is available, you know, all over the world. Otherwise, to get in touch with me, my website, drrobertmelillo.com, is very active. We have different courses available online. You can make appointments to come see us in our office. You can find out, you know, what's going on. The other thing is my social media, especially Instagram, is very active. And we're always putting up information on that and upcoming lectures and events and different things like that. We have 2 practices in New York. One is on Long Island, one is in New York City. And we actively see patients every day from all over the world here, literally. And, you know, then I also have an online course for professionals that is a fellowship certification course that people can take. We just finished that course live last year. So again, it's very updated with the most recent information. And then, of course, Disconnected Kids, but I have 8 best-selling books. I have a textbook called Neurobehavioral Disorders of Childhood and Evolutionary Perspective that, again, came out in 2004, but we're now working on a 2nd edition of that. So there's a lot of avenues out there to get to find out and to get connected to what we're doing.
Yeah, thank you so much for being here and sharing your wisdom, sharing your knowledge. It was amazing session. I really enjoyed it. I got a lot of answers, and I hope our audience also learned a lot from you. And basically, it's also on Insta, but the comments here I can't see say on Insta because of this, maybe StreamYard or something. But I'll get to the comments there and answer them. So thank you so much. It was lovely having you. Thank you so much.
It's my pleasure.